I'm Zanita Davis. I'm from Baltimore, Maryland. I'm a wife. I'm a mother of two very energetic little boys, one of them being Xavier. With Xavier, he was only, this happened in April. He was born in January. So it was just like 3 months of him being born before I felt like it was something wrong. So I came to Howard County and I was very, frantic.
I remember walking in and hearing him struggle to breathe and immediately calling for help between other nurses and quickly getting him on a monitor and recognizing that something was really happening and I needed help right away.
I remember him well because it's just something that sticks out. He was a young infant and checked in with his mom being concerned that he couldn't eat over the last 4 or 5 days, that he just wasn't able to feed. That inability to swallow suggested maybe something, some sort of neurologic problem right off the bat.
She mentioned botulism. So if you are digging and uprooting trees and maybe doing like new build communities, botulism spores fly around. It's something that you can't see, but it's there. And babies under a certain age don't have the gut health necessary to, I guess, filter out the bad stuff.
When it's ingested, it can cause a paralytic effect and gradually start to paralyze muscles throughout the body.
They had ran some tests, they had stabilized him, they got his sugar up, and they said they had reached out to Main Hospital, Hopkins, and that they were going to send an ambulance and rush him to the PICU. They were definitely rapid and responded amazingly. And then also kept checking on me. Like, I think that was they work in the ER. Their job is to be calm and to be vigilant in emergency situations, but to focus on the patient. But what they did for me was the part that I will always be grateful to Howard County for, because they saw me even when I couldn't speak. And they acknowledged me and they treated me like I was the patient too.
When your child comes in, you need to be able to understand what's happening. And sometimes it just takes a second to just tell them that, like, look, this is what's going on, this is what's happening, this is what's going on. I need you to sit down before, like, you fall down, because I can only care for one person at a time. I need to make sure that you're safe.
We have a fantastic team. Our nurses, techs, the secretaries, I'll say even the security guards who help us out with often behavioral health emergencies.
They did great. They did a great job. He was stable. The ambulance got there very quickly. Total, we spent about 6 weeks at Hopkins.
The patient happened to come in for a more routine problem. I forget how long, maybe 1.5 years afterwards, and she thanked me, and it was great to see him because he was now a thriving, walking, running toddler after his ordeal. So it was great to see him after that.
For him to be as happy and as smiley and as excited as he is about life now, it just warms my heart.